Well, good afternoon and welcome. You're listening to Men, Family, and Education Under Fire with Dr. Horace Williams on the Go Radio station, powering the voice of community and change. And thank you for tuning in tonight. We have a special show for you. I feel so much better today about this show because my special guest is none other than my daughter, Treasure. Welcome to the show, Treasure.
Thank you, Dad.
At this show, I'm going to get some of the framework out of the way. First of all, our disclaimer. We are not placing blame. We are just taking more responsibility. And so all my listeners, I'm going to give you a chance to go and talk to some parents. This show is going to be dedicated to returning to school. And the title of the show is going to be called Identifying Resources and Disorders in Our School. Now, we do know that in that school space, a lot of times our parents, Treasure, come to school and they don't quite understand the available resources. So, first of all, what I'm going to do is I'm going to read, and this is such a great honor for me, to be able to read a bio about my daughter. So you know we've come a long way. When a father can sit here and look at his child or his daughter, she's not my child, is that she's a young lady, a grown woman, and read a bio. But for this particular show, I want to just make sure that my listeners know her qualifications and her background before I introduce her to you. Okay, so here we go. Treasure, pronounced Treasure Williams, is a native of Detroit, Michigan. She graduated from Western Michigan University in Kalamazoo, Michigan, with a Bachelor's of Science in Speech, Language, Pathology, and Audiology, French, and later earned a Master's of Science degree in Communication and Disorders from Hampton University in Virginia. Treasure is also a member of the Doctorate in Speech Language Pathology cohort at Northwestern University. Treasure specializes in developing person-centered interventions for individuals with swallowing, cognitive, and communicative defects as a result of neurogenic dysfunction. She has been awarded a Certificate of Clinical Competency from the American Speech, Language, and Hearing Association. Additionally, she has been certified by the National Council of Certified Dementia Practitioners, as well as the Academy of Certified Brain Injury Specialists. So, without further ado, I'd like to introduce Ms. Treasure Williams. Welcome to the show, Treasure, and I'm going to try not to be so formal, but this situation that we're talking about, we want to help some parents today. We want to help some school districts, and we know, or at least I know, that speech pathology or communication language arts is very near and dear to your heart. So without further ado, let's get into the show so maybe we can help some folks tonight. First of all, my first question to you. What is speech language pathology all about?
Well, that's a great question, and I get asked that quite often. A speech language pathologist is a professional who diagnoses, intervenes, and assesses and plans treatment for individuals with disorders of communication, cognition, and swallowing, and voice. So that can range depending on the type of diagnosis, from a simple articulation disorder to receptive or expressive language disorders.
Okay.
And all the way up to the hospital level after a person has had a traumatic brain injury or a stroke or anything that lands them in the hospital.
Okay. Okay. So now, next question. What qualifications do speech pathologists need to have?
So in order to become a speech language pathologist, the entry-level degree is a master's degree. So upon receiving the master's degree, you have to gain a certificate of clinical competency from the American Speech, Language, and Hearing Association, which requires you to do a fellowship year. It also requires you to have passed and excelled at a state board test. And then on top of that, you also have to have your license to practice in whatever states that you want to deliver services to.
Okay. So in other words, you just can't be Ray to come up and talk to you and say, look, man, I can help you out. Just, do this or do that. So there is some.
You can be Ray, but you cannot call yourself a speech language pathologist.
Okay. And then he won't be certified by the board.
He will not be certified by the board. It's a very rigorous academic pursuit, but it is quite worth it.
And no knock on Ray. Ray can help you with some other things, but today we're going to focus on the professional side of these things. Okay, so that's pretty good. So the next question I want to ask, because our listeners are tuning in so that they can be aided and assisted in helping their children become the best that they could be. So now, talk about the school system. How does one know? Well, let me ask this question. How does a speech pathologist function within a school system? What are some of the things that you do in a school system?
So the wonderful thing about a speech language pathologist in the school system is that they are a part of an interdisciplinary team.
Okay.
So every school, as mandated by law, has to have a team of personnel that are equipped to deal with any individuals that might have special needs.
Okay.
So
that would fall under that special needs category.
Yes.
So listeners, I want you to understand this when you hear this. So just don't think that special needs falls under ADHD, other CI or cognitive impairment, or some other impairments. So speech language could be looked upon as one of those categories as a disorder.
And it commonly is. There's actually a term called SLI, which stands for speech language impairment.
Okay.
And every year, many children qualify for individualized education plans based on an SLI determination. So they are considered eligible for services under a speech language impairment or an articulation impairment or anything like that. So what a speech language pathologist does is that they come together with the interdisciplinary team that usually consists of a special education teacher, a case manager, a school social worker, occupational therapist, sometimes a physical therapist, and also the school psychologist. And so what we do is we act as the communication experts, and if a child is not performing up to par, or we're noticing that they are really struggling academically.
What kind of signs? That's a good point. What kind of signs would you notice that would tip you off to that?
Well, in the school system, the first thing we're looking at is academic performance. So that's where we look for our parents and our teachers, because they're our eyes on the ground. Every school will have speech language pathology services, but oftentimes this SLP, which is what we call them for short, is going to many different schools. If a school has one SLP all to themselves, they are very, very lucky.
Okay, very fortunate.
When an SLP comes into a building, they're really looking for insight from parents and the other teachers in the school. So the teachers will, write a referral, and they'll say, you know what, I notice little Johnny is really doing poorly in English. He's failing. Because the thing is that we don't want to wait for our children to fail in order to get them the help they need. So
I'm going to drop the pin on that one. So parents, that is one that we can drop it on. We don't want to wait till our children are failing before we understand that they need help. And that's what you're saying?
Yes.
Okay. Very good.
So most times the red flag comes up within the classroom setting,
Okay.
whether the child is performing poorly on just the academic work, or it could be that they're just not socializing and meeting developmental milestones.
Developmental milestones. That's another good term.
Yeah.
So in this particular case, as you explain that, give me just one example of a milestone that a child should be, and then if you can narrow it down to like an age, and I don't say I know, just give me a age that you think that we should be looking for certain things as from a developmental standpoint that this child should be exhibiting.
So between the ages of 3 and 5, a lot of language begins to develop. So socially, we're looking for children to be able to learn how to take turns, to request, to reject, to be able to attend, to maintain a topic for a certain amount of time. As far as articulation goes, we're looking for them to be able to produce certain speech sounds correctly.
Okay.
When it comes to grammar, we're looking for them to be able to put certain types of grammatical structures together.
Okay.
And, you'll always notice that children that have difficulty doing those types of things have difficulty also socializing. And so oftentimes you'll see little Johnny is getting into a lot of fights during recess because perhaps he does not know how to take turns. And it seems like a very small thing, but when you're in kindergarten, not being able to take turns or not being able to attend to something or not being able to make a request, like I have to use the restroom, is a milestone that should be met by a certain age. So when we're noticing that the child is having difficulty because they're not quite meeting that milestone, then we look to get the team involved.
Okay. Oh, that's great. So that's a lot of little nuggets that you just dropped right there, because I would have necessarily associated those two with a communications barrier.
Yes,
right?
It's called social language.
Social language.
Yeah, so there's five areas of communication. And we sometimes we segment them, but there's pragmatic language, which is our social language, right? How we use language. There's expressive language, there's receptive language, there's articulation, and then there's voice. And so we kind of look at those 5 areas when we're diagnosing and assessing a young person to see where they're performing, because a deficit in any of these areas can cause poor academic performance. So if a child is not expressing themselves, they're unable to perform well in language arts classes. If they don't have the receptive language skills that meet grade level, then they're not going to have they're not going to be on grade level for reading and writing. So when they sit for a standardized test, they will come across as failing, or when they sit down to write that essay, it'll seem like they're failing, but perhaps they didn't understand the directions that were given to them. By a certain age, children should be able to follow multi-step directions. So that child is constantly getting referred to the principal's office.
Or disciplinary
or discipline for behavioral instructions, because the teacher is always saying, go put your bag away, get your homework out, and then come sit on the 3rd spot of the rug. If they don't understand 3-step directions, then they might only do one part. And we'll start to notice a consistency in that these children are not on grade level for other things. And that's when they get us involved to say, well, maybe they're not just being defiant. Perhaps they're not just, maybe it's not a learning disorder. Maybe they have a language impairment, and we need to get them the tools they need to communicate successfully so that they can succeed.
Oh, awesome. That's great. Okay, moving along. How does one know if his or her child might benefit from the services of a speech pathologist?
I always say, the best ally in the school system is the parent.
Okay.
Because the parent
knows.
Again,
the parent. Here we go again. I'm going to drop one on that. Parents, we cannot get away from our responsibility. But again, as I've said in many shows, your child is an investment. So right now what we're saying, what Ms. Williams has just said, or Treasurer just said, is that the parent must know these things prior to going to school. You must know and understand your child in order to help them. But go ahead and finish your that question, if you would.
So often parents will say, you know what, I noticed when my child speaks, they always have a lisp, or, or I notice, what, my child just shuts down and they don't really talk that much. Or I notice they're not making as many friends, or they have difficulty on with their homework. But oftentimes the classroom teacher is, they're the eyes on the ground. So they'll say, you know what, I've noticed that, when I'm looking at their grammatical errors, there's a pattern. They always leave off the final consonants, or, they don't seem to really be understanding when I ask them to do this math word problem. So the teacher will usually say, you know what, I think we need to get them a language evaluation. But it's not simply coming to the speech language pathologist, and I can't stress that enough. In the school system, we act as a team, and the parent is one of the biggest team members. So, we have like I said, they have the school psychologist, the special ed teacher, and all of those people. We sit around a great big table, and the parent is right there at the table. So the parent is involved. Yes, absolutely. So everyone is a part of the team, and no decision is made by one person. Even after I, as the speech language pathologist, do an assessment, I'll make my recommendations, but then, I often, will turn to the parent and say, does that resonate with you? Is that true for you? Do you feel like that happened?
Keeping the parent involved.
And before we leave the room and before we've decided what our plan of action will be, everyone will have signed and said, you know what, this is what we want. Because sometimes you might think there's a great plan for a child based on your expertise, but that the parent might not want to go in that direction, and they might have some insight based on how that might impact their child. And so it really has to be a meeting of the minds to determine what is the best solution to make the child succeed.
Okay, that's great. So that's going to lead right into my next question, because we talk about a lot what the school is doing, what's happening in the school. How should we communicate in the home to assist our children in this area? How can the parents at home, what can be done at home?
So I don't know how to sugarcoat this, so
I'm
just going to say it in the biggest way.
Don't sugarcoat it. The best way to do it is not to do it. Don't sugarcoat it, because they need to hear the truth.
The best way to communicate in the home is to be mentally present with your children. Stop letting technology raise your children. If I was to say anything, I'll say it again.
Say that again. We're going to say it again. Please say it. And I'm going to drop on this one. Drop the mic. Say it again. Do what?
Stop letting technology raise your children. Often, people tell me, oh my goodness, my child knows how to work the iPhone better than I do. My child can get in this and reprogram this. But then the child cannot ask for more milk at school, or they don't know how to develop a thesis statement for an argument. They can't support their argument with evidence because they're not used to having an intelligent, well-crafted debate with an adult. Because, and I think, it's like I said, there's no blame place, because it's really, we're all sold these new iPads, and technology is just so prevalent, and we're told that, you just basically hook the kid up to this app and this will teach them how to do this. You put them in front of this show. But the best language intervention is natural language intervention. All of these, all the technology
That's
and
another
apps and
natural
computer,
Woo!
those are tools in the toolbox, but nothing takes the place of family game night. There is no app. There is no, there's no computer game. There's no video game.
Let me hold on for a second. Do you remember we used to play that killer Monopoly?
Yeah, we did.
House?
It was very serious.
Woo,
Every
serious
Wednesday.
Monopoly game in my house, ladies and gentlemen. Matter of fact, we went out and bought this game called Go Monopoly.
Yeah, it was very serious.
We took it to another level, and everybody was ruthless.
Feelings got hurt.
Feelings were
hurt. There's still some
some grudges. There's still some residue feelings from that Monopoly. And I'm talking about, we used to go at it, but we used to have fun with that.
Yeah,
that was
because
fun.
some people try to collect pass go and then not get their 200 and then think they can come back. Anybody who has a sibling that tries to get their 200 when they're halfway around the board, you understand.
Yep.
But really being engaged with your child at, in this age of technology where we're not sitting down at dinner and we're not having those, well, what did you do at school today? Everybody's just kind of on their phones, really disengaged. People are checking their social media every 5 minutes, and, children are getting their input from that. as a parent and, even as a family member, you want to communicate with your child. The best communication therapy is when you're truly communicating with another human being. So simple things like going to a grocery store and having your child get the list. That's practice following multi-step directions. That's practicing paying attention. That's practicing executive functioning skills. Wow. Sitting down with your child and asking them to tell you a story about what happened in school. That's asking them to create a narrative. Narrative language skills are things that are put on standardized tests where you have to write a narrative skill. When your child tells you they want something for Christmas, tell them to tell you why they think they deserve it. Those are persuasive writing skills. Wow. Tell them if a child tells you that they want a toy, tell them to come up with 3 reasons why that's a good product. That's making them get contextual evidence. That's making them do research. All those types of things, they don't cost money. Leapfrogs are great and iPads are great. I love them and I use them every day. But, the best therapy can be done with what God has given you.
Okay.
And just
being
the most valuable thing you can give your child is quality time.
Treating them like a human being. So before I go to the next question, I always like to say for our listeners that are just tuning in, you're listening to Men, Family, and Education Under Fire with Dr. Horace Williams on the Go Radio station, powering the voice of community and change. And if you're just joining us, we're talking about identifying resources and disorders in the school because we know that the school year is getting ready to start. I have a special guest with me today, which is my daughter, Miss Treasure Williams. Hi. She's here as a speech pathologist, and she's been shedding some light on this topic and how to make our students better in school, and also to the parents that may not understand some of these disorders and what's going on. So as we've been channeling this knowledge to you today, we're down to a few final thoughts. And I'm going to say, Treasure, and I appreciate you being here. Thank you so much. I'm so proud of you. Okay, I'm so proud of you for what you have achieved. So as we go down this road to help others that may not understand some of these disorders, especially in a public school setting, another question. How can parents work in tandem with the school's speech language pathologist to improve the students' outcomes? How can we improve students' outcomes, and what can parents do to work?
So being engaged and being receptive to the recommendations of the speech language pathologist are paramount to success.
Okay.
And also just, really making sure that whatever the speech language pathologist is addressing with your child, that you're following through on that at home, so everyone's on the same page. Children often have speech therapy homework. They have language homework that is sent home with them, so you want to make sure that they're completing that. You want to make sure that you are allowing them to unplug and, unplug.
Go into that. What does unplug mean? Tell me, what is unplug?
So that means taking the time to unplug from distractions, unplug from technology, and unplug from Facebook and Twitter and all of that stuff, and making sure that they are able to communicate and that they are communicating appropriately, and that we're all focused on a common goal, because we come together once a year for a meeting when a child is struggling, and we address their language issues, and we set a goal, and we don't come back together for another year. So that IEP meeting is once a year, unless there's a big issue or we need to, and we don't have an assessment for eligibility redetermination is every 3 years. So we really the chain of communication has to be very fluid, and it has to be very open between the parent and the speech language pathologist, where I know I've told parents, no problem is too small. You can email me, you can call me, and I call them. I really want to know everything that's going on, every change. If have they lost a tooth? Is a tooth growing in poorly? That might affect their articulation. Has something changed at home? So really just having a solid relationship with the IEP team, and using them as a sense of support, and being open to getting constructive feedback, and understanding that the IEP team is here for the parents, we're here for you, and we're here for the student, and our job is to make your child as successful as possible.
Okay, talk about IEPs for a minute because I think a lot of parents aren't quite sure as to how to get their students tested for an IEP. So, how would a parent um, go about getting their student tested for an IEP?
So the process for an individualized education plan or IEP is, it's
Okay, wait a minute, 1 second, because I want parents to get that. So, tell me what that acronym stands for one more time. IEP.
IEP stands for Individualized Education Plan.
Okay.
But the what we're trying to do in the school system is we're trying to avoid first before we even give a child an IEP, we want to make sure that if we can service their needs without putting them through the special education system
Okay.
and give them early intervention services, we can. So the first step is really seeing if any issues that are being experienced can be remediated
Okay.
by response to intervention, RTI, or they also call it multi-tiered support system,
Okay.
MTSS.
Okay.
So if oftentimes, I'll have a group of students where, they might have a little something, but they don't necessarily qualify. Or I know that if I pull them into a group therapy session, or if I worked and trained the teachers and the staff to support them, that we could improve this skill and that they would
Okay.
not
Of
need
the
it.
student.
Right. And they would not need that. Um, on the other hand, if we know for sure, this child is failing and we really need to step in, then what happens is that the teacher or the parent will refer to the child's study team or this team, the IEP team,
okay.
and make a request for an assessment. And so the IEP team will come together. And like I said, this is usually about 5 or 6 individuals. It could, the school nurse, if the child has some medical issues, the case manager, all these people come together and we review the records. We speak with the parent and say, so what are you seeing? And then we make depending on what domain the child's deficits fall under,
Okay.
every discipline will choose to whether they want to domain in and do an assessment.
Okay.
And so, oftentimes, a child might be presenting with an issue that sounds like a speech impairment, and we all get around and we talk and we say, this might not be speech impairment, this might actually be anxiety. And so the social worker will, I'll hand off to her and we'll say, okay, well, you do a brief speech assessment, but I'm going to do these 3 assessments on anxiety or psychosocial deficits, and we'll see.
That you say that, not to cut you off, but because I want my listeners to understand that there's a multiple set of issues could be coming out of this initial meeting. But talk about anxieties. Give me some clues, because some of our students do suffer from anxieties. PTSD,
Yes.
going to school, seeing vacant lots, seeing incidents happen. So give me a couple examples so parents can know what they need to look out for.
Well, a perfect example about how psychosocial difficulties can impact communication in the schools
Okay.
is selective mutism. We see a lot of children that are referred to speech because, they say, well, they're not talking, they don't talk.
Okay.
But in actuality, the child has a history of abuse or trauma,
Okay.
and they're
Okay, that's
choosing
trauma, not to talk.
they're choosing not to speak.
Okay.
And so instead of putting them in a situation where they're assessed and we're, testing them and then evaluating them based on their ability to speak, we have to disarm whatever anxiety or whatever psychosocial factors are contributing to the
Okay.
lack of speech. So that means the social worker or the school psychologist will be stepping in to offer intervention and support.
Okay.
Because the difference between not being able to speak and choosing not to speak is a very big difference.
All right.
And then there are children that do have really, really bad anxiety. A lot of times you'll see children that are disfluent or have a stuttering issue.
Okay.
And,
Yes.
they tend to stutter more when they're anxious, and that is a true communication impairment. So that's different. So that's when the speech language pathologist will step in. But a lot of times it's misdiagnosed and children are told, oh, just calm down, just take a deep breath. And so, you'll have a child that's been stuttering all this time, but they've been sent to therapists and everything because they say they're just nervous, and they really have a disfluency.
They have a disorder
yes,
going on.
and so that would be appropriate for the speech language pathologist. So that's why it's important that we all act as a team, because there has to be a lot of differential diagnosis. This is what the disorder isn't, and this is what the disorder is.
Yes, and the parents must, again, and parents, we just want you to be and do the best job you can with your children. A lot of times in schools, and I've witnessed this, that the students are going through certain situations and it's totally misunderstood. You know, why is your student acting like this? So-and-so is always getting in trouble. So-and-so is always talking too much. But a lot of times that could be a disorder, and because you're not the professional, the teacher is not necessarily the professional that understands this disorder. And if you don't communicate with the teacher, then the student is looked to be in a bad light, or they're always misbehaving, or they have poor behavior. So that's one of the importance of having good communication with the teachers in school. And Treasure, let me ask you this. So with all that being said, what are some other things that parents can do outside of the school in terms of getting help for their child if they come across this disorder within their child? What other things would you suggest that the parents do outside of school and maybe outside of the house in terms of professional help?
So depending upon the severity of the communication impairment or the presence, whether they have one or they don't, I'll start with, if your child does not have a specific communication impairment, but you just want to make sure that their communication is strong and that they're developing as they need to do, extracurricular activities are a wonderful way to foster language development. So theater, arts, debate team, things that encourage your child to stand up and present. That's why I always say, especially as an African-American person, the African-American church is so paramount to the development of these young children. Because from as a child, people can always say, I remember standing up in church,
saying that Easter speech,
because they groom you. They groom you to stand up and put you in. So we need more of that, so encouraging your children to perform, like I said, in theater and plays, and do debate teams. All those types of things really help foster language development skills for a typically developing child. Now, for a child that has a communication impairment, arts are always a wonderful way to increase
the arts.
Yes.
Bring the arts back to school. We need arts in school. Somebody stand up and say that. Bring arts back to school.
Yes, bringing arts back to school. And I will also say there are speech language pathologists that provide services outside of the school. So even if your child does not necessarily qualify for speech language pathology services in the school you have to have a communication impairment that negatively affects your academic performance.
Oh, in other words, before you get service.
But before you qualify for services. Before
you qualify. So say that again. Matter of fact, let's go say that again, because I want our listeners to know, if they're listening, this is what's going on. A lot of individuals
will come to me and say, I know my child stutters, or I know my child has a speech impairment. I can't really understand them. I know they have a list, but the child has a 4.0. Or the child is not failing. And so in the school system, we simply do not have the resources to service every child that has a communication impairment. Our job, according to law, is to service children who have communication impairments that negatively impact their academic performance.
Wow.
So that's why we work as a team, because the special education teacher or the child's regular general education teacher has to determine, the fact that little Johnny cannot follow directions means that he cannot do this test, and he's going to fail this test. Or the fact that little Susie cannot say her S sounds means that she can't stand up and give speeches. And this is a speech, this is a presenting class, so she's going to fail this class. So that's the difference. So I always encourage parents to, even if your child doesn't qualify for services, you can always go seek services from a speech language pathologist in your community, through a children's hospital, through private practice. You can
take an initiative.
You can go to ASHA.org, ASHA.org. That's the American Speech Language and Hearing Association.org. Yes, and so they have great resources for how to get in contact with a speech language pathologist in your area. They also have a list of all of the developmental milestones according to age that your child
Yes.
should be reaching. So you can go on this website, or you can simply Google language milestones, and charts will come up, and they will show you your child's age and what speech sounds they should be saying, what should they be able to put together as far as grammar wise, and what they should be able to do socially as well. So, take a look at those developmental milestone charts on asha.org, or simply Google them, and then really, go through a mental checklist and say, okay, is my kid able to kind of meet these? And then if you feel like that they're not, then you want to solicit the service of a speech language pathologist.
Oh, that's great. So that particular website that she mentioned, spell it again for us.
ASHA.org, ASHA.
Because the deal with that is you need to understand where your child or children are in this process, and then you can begin to help them. So once again, what we want to do on this show is give parents, guardians, grandparents, those who are taking care of school-aged children, the ability and resources to help these children become all they can be. And you've heard me say more than once, I just think that our children are much smarter than they're showing us, even in the school, on the statewide tests. So we're going to continue to try to bring this type of resource to all our listeners, and we want you to use them. Utilize this information that we're giving you. Don't just sit at home and say, oh, that sounds good. They don't know what they're talking about. We are bringing professionals to you. We're bringing folks that are helping people. And right now, Treasure is helping not only the children, but she works with adults as well. But this particular show, we are directly more to school-aged children, Treasure.
Yes.
And I want to say thank you again. Now, as we come to a close, is there anything that you can think of that we didn't talk about necessarily that can help parents? Can you give them some little nuggets that you can say, parents, you need to look out for this type of thing in your child? Okay, so I'm going to give you about 30 seconds. Give us something. Drop us something that we haven't talked about.
Well, I would always encourage parents to ask the right question and do your due diligence. So always make sure that when you are coming into a school that you know who your child's teachers are, that you know your child's strengths and weaknesses, and that you're monitoring them throughout the school year. So depending on where your child is in their matriculation and education, you want to make sure that you're monitoring them for any changes, and that, simple things like having a good breakfast, going to sleep,
Good breakfast.
and playing and having exposure to arts make a very big difference in your child's communication in school as well as their academic development.
Okay, well, thank you so much. Again, this is Men, Family, Education Under Fire with your host, Dr. Horace Williams. We've enjoyed our special guest, Miss Treasure Williams. And again, I'm going to say I'm so proud of my daughter. She's come such a long way. This is a proud moment for me as a father. And again, we are on the Go radio station, powering the voice of community and change. We're gonna challenge you not to change that dial. Tell someone about it. And we look forward to bringing another exciting topic to you next time. Have a great day, everybody. See you next time.